Good morning, everybody. Duffy here. Now, today I'm going to kind of depart from the norm and not do audio related stuff. Um, but this is something that I've wanted to do for a while, actually. It's been just over a year, and as some of you may know, by virtue of the fact that I can't shut up about anything, um, I had reflux surgery last year. Now, for those of you who are tuning into this video because of the title, you're asking yourself, what kind of reflux surgery? And, well, a hiatoplasty, but we'll get to that in a minute. The purpose of this video is that I know that there's a lot of people out there who don't have the wherewithal to figure out what's going on, and they've been going round and round and round in circles because they can't get any help for this. And I know because I was there. And here's how it all started. Like a few years ago, I started, I started feeling bad. And like it was kind of a gnawing feeling, just about right here. And then it proceeded to like a pain right here every now and then. And I almost wondered, because I was getting close to 40, if I wasn't developing some sort of coronary problems. I mean, I keep myself in good shape and I eat all right. Well, I haven't in the past year, but that's neither here nor there. But like I was kind of worried about it, and then it started burning. And then I realized, oh, well, this is like heartburn, it's recurrent heartburn. And I'd been going through a lot of things, I run 2 businesses, I'd gotten a divorce, my accountant screwed up my taxes, I about lost the house, and my mom had recently passed away. So, all things together, it's like, oh, well, it's stress. Well, a year goes by and it's like, it's not stress, it's getting worse. And so it had started to feel like every day I was drinking drain cleaner, like all day, every day. It hurt. And that's something you should pay attention to. That's absolutely something you should pay attention to. If something hurts all day, every day, there is a problem and it needs to be repaired. Unfortunately, the first doctor I went to, and there's no delicate way to put this, didn't give a shit. Did not give one fat rat's arse about this thing. And I can tell because like they put me under, they did a scope, they woke me up, and they assigned me omeprazole, which they said, okay, you have probably stomach ulcers, it'll go away in like 12 weeks. Well, 12 weeks come and go, nothing happens. It's like, well, sometimes it takes a little more. I try hard to get a hold of them. They have me on it for 12 more weeks, blah, 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 blah. And they're like, well, you got to take the medicine and blah, blah, blah. It's like they changed me from omeprazole to pantoprazole. And then they added famotidine on top of that. And then they added some kind of aluminum on top of that. And by the time I was getting disgusted with it, well, this was the second doctor that did those second drugs, because like 6 months in, I was getting disgusted with the first doctor. 8 months in, I decide I'm going to do some poking around because it's getting ridiculous and I can't function anymore. So I subscribe to several medical paper repositories. New England Journal of Medicine still sends me spam on the regular. But basically, I scratched the surface of what would normally be a degree in gastroenterology. And to all appearances, what it was a weak lower esophageal sphincter valve. Now, bear in mind, when this first guy saw me, he absolutely said, up and down, left and right, this is not a hiatal hernia. And I'd even mentioned, because I have a family history of hiatal hernia. And he's like, oh, no, you don't have that, and 8 months in, it's like, shut up and take your pills, and you'll be taking those the rest of your life, which, if they worked, it would have been one thing, but, well, no, it wouldn't have. Like, if you're on medicine forever, there's something wrong and it needs to be fixed. Point being, I had figured that my problem was a lower esophageal valve, and I was miserable, and I was desperate. So, what I had done is I had contacted a local surgeon about options. And your options seem to be, for something like this, surgically, either a Nissen fundoplication with a hiatoplasty, where they take your stomach and divide it, and then they fold it around the esophagus, and then they will suture it, and it will create out of the top of your stomach a valve. Now, there's downsides to that. Like, the upside is you don't have any more reflux pain anymore. But the downside is that, you can't burp, you can't vomit, it needs retouched after like 5 years. And I'm relatively young, and I didn't feel like going in another, cross my fingers, 10 or 12 times to get maintenance on the thing. So I had kind of ruled that out as an option. There's another option called a TIF, a transoral incisionless fundoplication. And I'm getting ahead of myself. What the problem here is if you have a valve, and I'm using a sock as an example, from your esophagus, there's a valve here that goes into your stomach, and it keeps it shut tight. Well, if that valve is malfunctioning, it's loose, and it lets acid come up into your stomach, especially when you're laying down, or when you're running, or doing sit-ups, or anything like that. So, a lot of times what they'll do is they'll fold your stomach around that and make a tighter valve, which I didn't want to have done. Another thing they'll do sometimes is a TIF, which they run like a tool down your esophagus. They gather up some of your stomach around your esophagus, and they staple it in place to again kind of create an artificial little valve down there. And I didn't necessarily want that either. Another option is an implant called links. And again, actually, this is a great example because they put a ring of magnets around it, and the magnets can expand when you swallow something, but they generally hold it closed otherwise, which can affect you if you have an MRI, or you can actually, develop problems with it if it gets either stuck closed or stuck open due to scar tissue. I know someone who had one. She loves it. It worked great for her. I was hesitant, but that was the way I was leaning. Until I learned about another procedure called Stretta. Now, this is all assuming that I had a weak lower esophageal valve, an LES. But the way Stretta works is they run a wand down your throat, like a little catheter, and it has a balloon on the end of it. And that catheter swells up, and here's the part where I need you guys to stick with me. It inserts a bunch of little needles into that little sphincter valve. And it uses radioablation to heat those needles up to about the temperature of a scalding cup of coffee. And then it retracts them and rotates and does it again. And they do several layers of like pinpricks down the thing. And what it does is when it heals, it thickens that valve up a little bit, and it keeps it from like allowing acid through. All of these are viable options for controlling acid. And I was really excited about the Stretta because it was an outpatient procedure. It was simple, and it seemed fairly non-invasive compared to the other ones. So I prepared to go and get Stretta. Except no one around here does it. So I'm on the phone for 2 months, like arranging appointments with doctors who do this procedure. And I found a couple, and I finally found one relatively near me, up in Cleveland, which is a 5-hour drive, no big deal, especially not for what I was dealing with, who did it. And her name was Dr. Lena Kaitan. And Dr. Kaitan, if you ever see this, you are wonderful. So I had presented like a mountain of data on things that I had observed about my condition. Well, this exacerbates it. This is a problem. This is not. Blah, blah, blah. This is what I think it is. And I had charts of every day, like things that had went on. I had like data. Because I couldn't get any doctors to really pay much attention to me. Always be your own advocate. You have to. If a doctor is not helping you, you need to pursue it. Anyway, Dr. Kaitan took a look at this mountain of papers I stuck in front of her, and she said, it looks like you're well informed. It looks like, you're probably right. She said, before we proceed on to this Stretta procedure, I want you to have a couple more tests to be sure that you're a candidate for it and to clear you for it. And I'm like, okay, fine. Now, if you're going in for any anti-reflux surgery procedure, here is what to expect. The first thing they're going to do is an upper GI scope. And I had already had that done. My first doctor did an upper GI scope. They said, well, you don't have a hiatal hernia. Spoiler alert, I did. But we'll get back to that. You don't have a hiatal hernia. You do have a Schottky's ring. Looks like you have some irritation that may or may not turn into Barrett's esophagus. Spoiler alert, it wasn't. Whew. If you do hear that you have Barrett's esophagus, it's not necessarily the worst thing in the world, but you do need to start being proactive about getting your situation corrected, or it could progress into worse things. But basically, the first doctor, who didn't care, just basically ran a scope down, popped it up, and said, oh, you're fine. You will have an upper GI scope. They will knock you out. They will run a camera down your throat. They'll take a look around and see what's going on in there, and then they'll inform you what your particular condition is. After that, they will know how to proceed. If you are proceeding with some sort of anti-reflux surgery, the next steps are interesting because they want to see if you are getting acid reflux in your esophagus and if your esophagus is functioning correctly. So the next two tests are likely to be a Bravo test and an esophageal motility test, like the pressure that your esophagus muscles are exerting. So the first test is really cool, and this is going to be squeamish for some of you guys. But the Bravo test, they take a little capsule that is teeny, teeny, tiny, and it has a radio transmitter in it that transmits a signal every time it detects acid. And they're going to knock you out, and they're going to staple that in your esophagus. I know, I just lost some of you. It doesn't hurt. It's a little uncomfortable when you swallow. You can definitely feel it in there for the week that it sits there. It sits there anywhere between 3 and 7 days, and it falls out, and it passes with everything else, and it's fine. So it's an experience, but they knock you out, they staple this little transmitter in there. You have to wear a little pager on your hip so that it can record what the capsule detects, and that's called a Bravo test. And it's really a simple procedure, and it's nothing to worry about. I did it. Again, it feels weird, but it's fine. It feels almost like when you swallow a potato chip and it gets stuck there and it doesn't go down for a minute. It's not like the sharp ones that hurt all the time. It's just like when it gets stuck a little bit and you need to drink a little water to move it along, but except it doesn't move along. It just kind of stays there and you get used to it until it disappears. The Bravo test is not bad. The one that shouldn't be bad for anyone, and I'm going to tell a story, but don't let it scare you. So the other test is the motility test, and what they do is they take a small probe. It has little bumps on it, and the little bumps are sensors, and they're about as wide around as a thin pencil, And they take this sensor and they pass it up your nose and down into your throat. And then they have you drink water, and it measures how well your esophagus is functioning to make sure you don't have peristalsis or difficulty swallowing. Now, when I went in, it was interesting because the first thing I noticed when I got to the hospital after a 5-hour drive was that the fire alarms were all going off over and over and over and over. And then they came and got me, and then they realized that I was not, in fact, Olivia. And then they put me back in the waiting room. And then they came and got me again. Well, apparently, I have non-standard anatomy in my head. No, save your jokes for later. So normally they pass this up and down through your throat, but for whatever reason, the baffles in my sinuses are shaped oddly, and they couldn't get it through. So they're trying and trying and trying, and after about 45 minutes, the first doctor gives up. Well, the first nurse gives up, goes and gets another nurse, who tries for another half hour. They manage to get it about halfway down and then cut off my windpipe for about 30 seconds because it went the wrong way. Now, if that happens to you, don't panic. You're fine. But then they couldn't get it there, and, they tried a third doctor, and then the first doctor tried again. So anywho, after 3 people made 4 attempts for an hour and a half, and I'm sitting there gagging and covered in, snot and lube and tears and sweat and puke, because if they're shoving something down your throat repeatedly, you are going to vomit. And I'm holding a glass of water in one hand and a glass of puke in the other, and, my stomach is so full of water, I can't drink another drop. I mean, it was bad. So don't let this scare you away. This will not be the case for you. I am just a weird little mutant. But I wanted to tell you this just in case you do have difficulty. It's not the end of the world, and they will get it done for you. It is worth it to get rid of your problem. But if none of you will be expected to get to that point. I insisted they keep going. You might not do that. If you can't do that, what they will do with you is what they did with my non-standard ass, is they will knock you out and do it while you are sedated and unconscious, because it's a little easier for them to do. And it worked just fine. I woke up, I did the test, it was easy peasy. They removed the pressure sensor, and I was on my way. Now, I've skipped something. When they did the Bravo test on me, they woke me up and said, "Well, did you know you have a hiatal hernia?" And the first thing out of my mouth was, "No, I don't." Because I had had my first doctor tell me repeatedly that, "No, you don't have a hiatal hernia. No, that couldn't be what's causing this. Blah, 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 blah." Because he didn't care to look for it when he scoped me the first time. So he just insisted that I didn't have it, which threw my diagnosis back 8 months. And I'm not bitter about it. Yes, I am. Anyhow. Now that I'm armed with knowledge, data, and test results, we have reflux, we have a type 2 hiatal hernia, which I'll explain in a minute, and we have our motility tests. We're cleared for a procedure. Now, if any of you guys are proceeding on from here with Stretta, it's going to be great. They're going to roll you in. They're going to run the wand down your throat. They're going to zap your lower esophageal sphincter. They're going to wake you up. They're going to put you on a liquid diet for a couple of weeks, and in all likelihood, you're going to be fine. Now, if you guys are doing a more advanced surgery, like a fundoplication, a TIF, a link surgery, or a hiatoplasty, which is what I had, stick with me. Because likely you have a hiatal hernia. And there's a couple of types. The first kind of hiatal hernia, let's get our sock again, is a type 1. And if you have your valve here, what's likely happening is your stomach is folding up inside of your esophagus through that valve, like this. And that is a type 1 hiatal hernia. That is the most common type. A lot of people have them, and they don't even know that they have them. Some people don't experience any effects from them, and that's fine. Some people do, and you need to get them taken care of. That is not what I had. I had a type 2 hiatal hernia, which is a lot more rare and dangerous. So what had happened with me is my stomach had decided to come up through that valve next to my esophagus and pay my lungs a little visit. So what I had to have done was probably looking at, depending on the severity, a hiatoplasty and a fundoplication. We've already covered a fundoplication and what it is. With a hiatoplasty, they usually accompany a fundoplication. But I wanted one by itself, and after a lot of testing and hemming and hawing, my surgeon agreed. The opening through your diaphragm, which is the membrane you use to breathe, has a hole in it for your esophagus to pass through. And if that hole is fairly large, your stomach can come up through it, like that. So what a hiatoplasty does is they kind of trim the connective tissue of your stomach away. They take that hole in your diaphragm, they kind of like trim the edges, scuff them up real good, and then they sew them together with a piece of mesh so that the hole is permanently smaller, which means your stomach can't migrate up through it next to your esophagus, which is what I had done. Now, after you have any of these surgeries done, whether it's a hiatoplasty, or a hiatoplasty with fundoplication, or a TIF, or to some lesser degree, a hiatoplasty with links, or anything like that, anytime they're like opening you up and messing with your digestive system, there's going to be a recovery period. And I'll tell you, the recovery period on this is a little rough, but it's absolutely worth it, and it's manageable. So, no one tells you what to expect. And the first thing to expect is like you're going to be on a liquid diet for a couple of weeks, and that's fine. Milkshakes are great. Soup is wonderful. Don't sweat that. Protein shakes are fine. But one of the things that you are going to find when you have this surgery that they'll warn you about, but they don't really explain, is you are going to have a little trouble swallowing at first. And I don't mean like it's going to stick in the back of your throat and you're going to feel like you're choking. That's not it. Don't worry about that. What's going to happen is you're going to drink something or eat something and you're going to feel fine. And then you're going to take another bite and swallow it, or another sip and swallow it, and you're probably also going to feel fine. But about the third one that you take, you're going to realize none of it's gone into your stomach. It is sitting there on top of that valve. And suddenly, it's starting to hurt. And it's not going down, and it feels like all of it's kind of filled up to about right here. Now, don't panic if this happens, because it's perfectly normal. Now, they're going to tell you not to vomit or not to heave or anything like that right after this surgery, because it can put a lot of strain on that. And that's true. What you want to do in this situation, and I can't stress this enough, is to stay calm. It happens after the surgery until you're healed. And it's not, well, I'm going to say it's not a big deal to you. It's probably going to seem like the world's biggest deal if it happens. But you need to stay calm. My dad, who also has a hiatal hernia, and sometimes just food will get stuck there, told me the most valuable thing you can ever hear if you're suffering from something like this. And it really will help if you're alone and this happens and you're panicking. He said to me, he said, now the important thing to remember, you can breathe. Because that's the thing. Most people, like, when you're choking, you think, I can't breathe, I can't breathe. Like, if this happens to you, breathe deeply. Relax. You can breathe. You're fine. You're absolutely fine. Food is in a pipe that is meant to accommodate food, if only in transit. But you have food in a pipe that is made to accommodate food, and you can breathe just fine. It just induces a panic because something's not right. Now, if you do what my stupid ass did and take a vitamin pill, like 1 week after the surgery when you're supposed to, it was a soft gel. And I thought, soft gel, it's slippery, it'll go down. It didn't. It lodged right there at the bottom. And oh, it hurt. Like, it stayed there. It didn't go away for 25 minutes. And I'm standing at the sink. And the problem is, when something is stuck right there, your body's initial response, involuntary, is to get it out. So I'm sitting there, and it hurts more and more and more, and I'm foaming at the mouth, because that's what your body does. And I got to admit, it was unflattering, but like, I'm not, modesty's out the window, because I'm trying to help you if you find yourself in the same situation. I'm standing there at the sink. I can't bring it up because that's going to hurt the stitches. So I don't want to, force it to come up. And it's not coming up on its own. It's just sitting there hurting like heck. Can't stress this enough. Do not Do not chug water trying to get this thing to go down, because if that valve is blocked, the way that your esophagus tries to move water down, it will push the water down. Water does not compress, and it's gonna hurt. And a lot of it will come back up, and that's fine if it does. Don't heave, but like if your throat muscles bring water back up, it's okay to spit it out. But if you're standing there, and you do want to try to ease it along, tiny, tiny, tiny sips of clear, pure water, and nothing else. And when it finally does go down, you're going to feel like you got punched in the stomach by Mike Tyson. So, it's unpleasant. Hopefully this doesn't happen to you, but in the off chance that it does, it is fine, and it does get better. So this is for the first little bit. Now, as healing progresses, you're going to find that, your swallowing gets better, your tolerances get better. Occasionally you're still going to feel, a little bit of reflux burn, and occasionally you're still going to feel, a little bit of stomach pain, right here just below your sternum where that valve is. You're going to feel that, and it's going to feel occasionally like you got punched in the stomach, like it did before you got the surgery. And that's because that's where it hurts when that's aggravated. And while this is healing, you are going to aggravate it. Because, as was explained to me by the surgeon, your diaphragm moves all the time when you breathe. And it's like having a cut on your finger and just doing this all day, all night, every day. That cut's going to take a while to heal, and it's going to be a little sore while it does. A year into my surgery, I am so glad that I got it, and I feel so much better than I did. Do I have, the occasional stomach pain and, burning? Sure, every once in a while, but no more than probably your average Joe. But really, I am so much better than I was, and would I do it again? Absolutely, in a heartbeat. The way they go about any of these surgeries, with a hiatoplasty, a fundoplication, anything like that, is they do it laparoscopically, which means you will have 5 little holes poked in you. They'll fold your liver aside, and they'll pull your stomach down out of your chest cavity or out of your esophagus, and then they'll proceed to make the opening smaller. And if you're having a fundoplication, then they'll perform that while they're in there. When you wake up, one of the things that they're going to tell you is you need to move around. And you do, because they inflate you with air when they do the surgery. And if you don't move around afterwards, it takes a while for that to clear out, and while it doesn't clear out, it feels like someone has taken a broomstick and shoved it through your shoulder. It feels like you've been impaled by something dull. And they liken it to a heart attack. And it's a good analogy as far as I can tell. But if your nurse tells you to get up and walk around every 20 minutes, and you feel like you can't do it, go ahead and do it, because it makes you feel better a lot faster after the surgery. Keep up with your exercises. They'll give you a little respirometer to make sure that your diaphragm heals up nicely and stays strong. Do all that, and you're going to be back on your feet in no time. But most importantly, if something is wrong and you are having pain every day and it is burning, don't just sit there and pop pills for 6 years, because that's, what your insurance will cover. We'll just keep giving them pills. It's cheaper than actually fixing the problem. No, this is your long-term health that is at stake. Actually, is that still recording? Yes. This is your long-term health that's at stake. And if you can manage a small problem with occasional medication, that's one thing. But if you have constant all-day, everyday pain, whether you're taking pills or not, and you have to take a handful of pills just to get by every day, that is a problem that needs to be corrected. And there is the technology out there to do it. It's amazing. It sounds scary, but it's not. Yeah, sure, you're gonna feel a little bad after the surgery for a bit. I'm not going to lie to you. It's not an easy surgery. But living for the entire rest of your life in pain is much worse than a couple of months to, like, get back to feeling where you were, and then a couple more months to feel like way better than you did, and then several more months to feel just like you did before anything happened. So you don't really have anything to lose here. Yes, sometimes surgeries do fail, and sometimes they don't solve the problem. And that's a relatively small percentage, and that is a risk that you do take when you're undergoing any kind of medical procedure. But the alternative is living the rest of your life with something horrible. And I mean, that's a choice that you're welcome to make, but I can't speak for you guys, and I can't recommend what you should do for you. But for me, I think a very low risk of staying where I'm at versus a very high chance of getting better, that's absolutely worth pursuing. But I thought that this might help a lot of you who are kind of starting to go through this procedure and wanted to know what to expect. One sec. Oh, one other thing. If you're suffering from upper GI stuff and burning and things like that, if you have allergies, if you have hay fever, if you have things like this, because I didn't realize this until after the surgery. Part of my problem was the hiatal hernia. The other part was the allergies. See, I would notice that the burning was gone, except for when my allergies were really bad, and it kind of came back all the time when my allergies were bad. And what was happening was that hiatal hernia, yes, was allowing acid up in there to make my esophagus raw. But the other part of the equation was if you have drainage, you might have something called eosinophilic esophagitis, which kind of just compounds the problem. So you may want to look into that as well as you're recovering. Now, if you have a hiatal hernia, you have a weak lower esophageal sphincter, you're getting acid into your esophagus, yeah, you want to get that dealt with first. But if they tell you, no, you don't have any acid in your esophagus, blah, 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 you may look into that because, sometimes it's never just one cause. But point being, take an interest, get data on yourself. Just all of the data you can compile, all of the factors, all of the circumstances, everything like that. Spot patterns and find a doctor that will help you. If a doctor wants to just shrug their shoulders and shove a bunch more pills at you, especially pills that you shouldn't be taking long term, because a lot of proton pump inhibitors are not made for long-term use. They can damage your kidneys and things long-term. So if you're young, you may not want to go down that road just yet, So if you know something's wrong and it's not getting better, find a doctor who will help you fix it. I'm not pushing any one method over the other. I had something unusual, we're keeping Stretta in our back pocket in case I need a little touch-up with this. I might go get one if I find down the road that just a hiatoplasty by itself isn't working well. It is right now, and normally they won't do that. Normally if they open you up, they want to give you a fundoplication or something that will be a permanent solution or semi-permanent solution. Mine wasn't bad enough to necessitate that, and I talked with my doctor, and I got by with just a hiatoplasty without fundoplication. You may not be a candidate for that. You may want to look into the links with the magnets, but, know that there are downsides to that and there's upsides to that. That would have been one of my choices. TIF, transoral incisionless fundoplication, and TIF2. Those are viable options, too, if you don't want to have a full Nissen fundoplication. But really, look into all these things and find out exactly which one is right for you. It pays you to read up on them, look into exactly what they are and what they do for you and what they do to you. Because if your doctor recommends one, okay, it might be what's right for you. But sometimes there's a viable option. The Stretta I was talking about is not offered anywhere around here, and doctors don't know about it around here. And like, I had to travel 5 hours to a doctor that would consider, well, who knew what it was and who would consider giving it to me. So if you don't necessarily like your options, like, I mean, sometimes we're thrust into situations where we don't like our options and we have to pick, but push to get help and push for a solution that's right for you. And you may have to work hard to get it, but it's definitely worth looking into all of it. And I hope this helps some of you. Have a great day, and I'll try to cut this down in post to where it's not as rambling and makes a lot more sense and is cohesive, but no promises, guys. Anywho, stay healthy, take care, and best of luck with everything.